One of the very good utilization of this wireless and cordless ultrasound system is to assess a patient with the Quervain's disease. You can see that the radial styloid of this patient is swollen, and if we scan this first compartment, and you can see when the first compartment getting over the second compartment, the distal branches of the superficial radial nerve just getting over the first compartment, and it is the impingement of this superficial radial nerve which gives the pain of the de Quervain's disease. And when we scan this first compartment, the APL and EPB, over the radial styloid, you can see the thickening of the tendon sheath. This is a thin, and that's becoming thick, very thick, and keeps going distally, and the tendon sheath becomes normal now, and it keeps going distally, and it becomes normal. So when I turn the transducer 90 degree, this time we are in the long axis to the first compartment. You can see the thickened tendon sheath right over the first compartment, and when you move the thumb, and you can see the tendons moves underneath the thickened tendon sheath, and this is a typical de Quervain's disease. And when we turn on the power Doppler, and you can see the increase in vascularity over the tendon sheath right now, right here. This is the vascularity over the tendon sheath. So when I turn the transducer 90 degree, this time you can also see the increase in vascularity over the thickened part of the tendon sheath, which is typically for the de Quervain's disease. And for the treatment of this de Quervain's disease, we need to hydrodissect the superficial radial nerve, and at the same time we need to treat the swollen tendon sheath, and also to reduce the friction between the first compartment and the tendon sheath. So that's for the de Quervain's disease.